Chronic stress, when experienced over periods, can have a significant impact on physical health. It leads to a sustained release of stress hormones like cortisol, which can contribute to a range of health problems. These include weakened immune function and increased risk of cardiovascular diseases, digestive issues, and worsened chronic pain conditions. In this video information, understanding the between chronic stress and physical health is essential for developing effective strategies to manage its effects on overall well-being. Musculoskeletal system. When the body is stressed, muscles tend to tense up. Muscle tension is often a reflex reaction to stress, the body's way of guarding against potential injury and chronic pain. With sudden stress, muscles tense up temporarily and then release their tension once the stressor is removed. However, chronic stress can keep the muscles in a constant state of guardedness. Prolonged muscle tension can trigger additional physiological reactions and potentially lead to stress-related disorders. For instance, both tension-type headaches and migraines are commonly associated with chronic muscle tension in the shoulders, neck, and head. Musculoskeletal chronic pain in the lower back and upper extremities has also been linked to stress, particularly job-related stress. Millions of individuals experience chronic pain due to musculoskeletal disorders. While there may be an initial injury, whether an individual develops chronic pain often depends on their response to the injury. Those who are overly fearful of pain and re-injury and who focus solely on physical causes and cures tend to have a worse recovery compared to those who engage in moderate, physician-supervised activity. Prolonged muscle tension and subsequent muscle atrophy from disuse can contribute to chronic, stress-related musculoskeletal conditions. Relaxation techniques and other stress-relieving activities have been shown to effectively reduce muscle tension, decrease the incidence of certain stress-related disorders such as headaches, and enhance overall well-being. For individuals with chronic pain conditions, these stress-relieving practices can also improve mood and daily functioning. This revision clarifies the connection between muscle tension and stress-related disorders and emphasizes the role of stress management in improving health outcomes. Respiratory system. The respiratory system supplies oxygen to cells and removes carbon dioxide waste from the body. Air enters through the nose or mouth and travels down the trachea, windpipe, into the lungs via the bronchi. Inside the lungs, the bronchi branch into smaller tubes called bronchioles, which end in tiny air sacs known as alveoli. Oxygen is exchanged with carbon dioxide in the alveoli, and oxygenated blood is then circulated to the rest of the body. Stress and strong emotions can manifest with respiratory symptoms such as shortness of breath and rapid breathing due to the constriction of the airways. For individuals without pre-existing respiratory conditions, this typically does not pose a significant problem as the body can usually manage the additional respiratory demand. However, psychological stressors can exacerbate breathing problems in individuals with pre-existing respiratory conditions such as asthma and chronic obstructive pulmonary disease (COPD), which includes emphysema and chronic bronchitis. Some research indicates that acute stress, such as the death of a loved one, can trigger asthma attacks. Additionally, the rapid breathing or hyperventilation associated with stress can lead to chronic panic attacks in individuals who are predisposed to them. Cardiovascular system. The heart and blood vessels make up the cardiovascular system, which works together to supply nourishment and oxygen to the body's organs. This system also plays a crucial role in the body's response to stress. Acute stress, short-term or immediate stressors such as meeting deadlines, being stuck in traffic, or suddenly slamming on the brakes to avoid an accident, leads to an increase in heart rate and stronger contractions of the heart muscle. Stress hormones, including adrenaline, noradrenaline, and cortisol, act as messengers to initiate these physiological changes. During acute stress, blood vessels that direct blood to large muscles and the heart dilate, increasing blood flow to these areas and elevating blood pressure. This physiological response is commonly referred to as the fight or flight response. Once the stressor is resolved, the body typically returns to its normal state. Chronic stress, ongoing long-term stress, can have detrimental effects on the heart and blood vessels. Persistent increases in heart rate, elevated stress hormone levels, and sustained high blood pressure can lead to long-term health problems, including hypertension, heart attack, and stroke. Additionally, chronic stress may contribute to inflammation within the circulatory system, particularly in the coronary arteries, which is one mechanism that links stress to an increased risk of heart attacks. Stress may also influence cholesterol levels, potentially exacerbating cardiovascular risk. The impact of stress on heart disease can differ between women based on their menopausal status. Premenopausal women benefit from the protective effects of estrogen, which helps blood vessels respond better to stress and may offer some protection against heart disease. However, postmenopausal women who experience a decline in estrogen levels lose this protective effect and are at greater risk for the adverse effects of stress on cardiovascular health. Endocrine system. When someone perceives a situation as challenging, threatening, or uncontrollable, the brain initiates a cascade of events involving the hypothalamic pituitary adrenal (HPA) axis, which drives the endocrine stress response. This results in an increase in the production of steroid hormones called glucocorticoids, the most notable of which is cortisol, often referred to as the stress hormone. The HPA axis, during times of stress, the hypothalamus, a critical brain region that links the brain to the endocrine system, signals the pituitary gland to release adrenocorticotropic hormone. ACT then stimulates the adrenal glands located above the kidneys to produce and release cortisol. Cortisol helps increase the availability of energy by mobilizing glucose and fatty acids from the liver. Normally, cortisol levels fluctuate throughout the day, rising in the early morning to help with waking and gradually declining through the day, providing a daily rhythm of energy. During a stressful event, elevated cortisol levels can provide the additional energy needed to handle prolonged or intense challenges. Stress and health. This disruption in communication can contribute to the development of various physical and mental health conditions, including chronic fatigue and metabolic disorders, diabetes, obesity, depression, and immune system disorders. Gut and stress. The gut contains hundreds of millions of neurons and functions as a complex, semi-independent system often referred to as the enteric nervous system. This system is in constant communication with the brain, which explains sensations like feeling butterflies in the stomach. Stress can disrupt this brain-gut communication, potentially exacerbating symptoms such as pain, bloating, and general gut discomfort. Additionally, the gut is populated by millions of bacteria which play a crucial role in gut health and can influence brain function, mood, and emotional well-being. Brain-gut axis. Stress is associated with alterations in gut bacteria, which can, in turn, affect mood. Thus, the interplay between the gut's nerves and its bacterial inhabitants can significantly impact brain function and vice versa. Early life stress can affect the development of the nervous system and the body's stress response, potentially increasing the risk of future gut-related issues or dysfunctions. Esophagus. Under stress, individuals may experience changes in eating habits such as eating more or less than usual or consuming more alcohol or tobacco. These changes can lead to heartburn or acid reflux, and stress or exhaustion can exacerbate existing heartburn. In rare cases, intense stress can trigger esophageal spasms, which may be mistaken for a heart attack. Stress may also make swallowing more difficult or increase the amount of air swallowed, leading to more burping, gassiness, and bloating. Stomach. Stress can heighten the perception of pain, bloating, nausea, and other stomach discomforts, and severe stress may lead to vomiting. Stress can also cause fluctuations in appetite, which, combined with unhealthy dietary choices, may negatively affect mood. Contrary to popular belief, stress does not directly increase stomach acid production or cause stomach ulcers. Stomach ulcers are primarily caused by infection with the bacterium Helicobacter pylori. However, stress may exacerbate the symptoms of existing ulcers. Bowel. Stress can intensify pain, bloating, or discomfort in the bowels and influence the speed at which food moves through the digestive tract, leading to diarrhea or constipation. Stress can also induce muscle spasms in the bowel, causing pain. Stress can impact digestion and the absorption of nutrients in the intestines, potentially increasing gas production related to nutrient absorption. Additionally, stress can weaken the intestinal barrier, allowing gut bacteria to enter the body. While most of these bacteria are managed by the immune system and do not cause illness, chronic low-level inflammation due to stress can lead to persistent mild symptoms. Conclusion. Chronic stress profoundly affects physical health across multiple systems in the body. Its impact is evident in the musculoskeletal system through persistent muscle tension and pain, in the respiratory system with exacerbated breathing issues, in the cardiovascular system with increased risk of heart disease, in the endocrine system through hormonal imbalances, and in the gastrointestinal system with disrupted digestion and gut health. Understanding these effects highlights the importance of effective stress management techniques. By addressing and mitigating chronic stress, individuals can improve their overall health and well-being, fostering a more balanced and resilient life.